Hi, I'd like to take this opportunity to discuss and shed a little bit of light on how we at ManorDentalHealth are treating shielded or non-shielded patients. By now, if you are in a highly vulnerable group, you will know that you are counted as shielded. However, we as dentists have to take consideration that those of you who are at moderate risk from coronavirus. Because as you know, coronavirus has put on a whole new level of cross-infection procedures that dentists have to use within their practice. Luckily, over the years, we've become very skilled at implementing cross-infection and the protocols required. So now we have a full suite of procedures that we use. But one of those procedures is to keep our at-risk groups apart. So, moderately at risk, and hence in a shielded group for dental treatments. And I'm just going to read off the list. That's those of you who are 70 or older, have a lung condition that's not severe, such as asthma, COPD, emphysema or bronchitis, have heart disease, such as heart failure, have diabetes, have chronic kidney disease, have liver disease, such as hepatitis, have a condition affecting the brain or nerves, such as Parkinson's disease, motor neuron disease, MS or cerebral palsy, have a condition that means you are at high risk of getting infections, are taking medicine that can affect the immune system, such as low doses of steroids, are very obese, a BMI of 40 or over, are pregnant. If you're in that group, we also have to keep you as shielded. As you can imagine, as a dental practice, that covers quite a lot of my patients within quite a wide age range. So it's for that reason we're trying to put certain times aside to treat our shielded patients. One of those times is 8 o'clock in the morning, but that's also a very popular time with other non-shielded patients. The other time we can use is 2 o'clock in the afternoon. That's at the beginning of a session when the surgery is being fallow for lunchtime. The other thing we're doing is at the moment we've set aside a Wednesday. That full day is for shielded patients only. You may find when you call reception, we do ask you more questions about your medical history. You may have been asked those questions quite recently, but we do have to keep asking and checking and just being sure where we book our patients. You may also find that we discover we've booked you in the wrong place at the wrong time that puts you, mixes you in with non-shielded patients. If that occurs, you may find that we ring and ask you to rearrange the appointment. We're sorry for that, but it's just part and parcel of the things we're having to do to protect you. Because at the end of the day, that's what we're trying to do, is protect you from other patients that may be at more risk of actually carrying the coronavirus, and even if they are carrying it, are at less risk to themselves. We will try and keep patients very separated, or even more separated I should say, on our shielded days. If you have any questions about this, then please feel free to call us. If you want to ask us about what procedures we've got in place to protect patients from coronavirus and also to protect ourselves from coronavirus, please feel free to give us a ring or email us. Thank you for listening.